Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Saturday, August 22, 2026, episode 109. Today, the field is publishing its playbooks. The International Rescue Committee put the operating model behind its Signpost crisis triage on the record. The largest nursing organization in the US took $5 million US to teach rural nurses what AI can and cannot do. And Kazakhstan switched on sensors above 3 glacial lakes rated most likely to burst. Deployment detail, not demos. We start with the International Rescue Committee, the IRC, which has just put on the record how it actually runs AI inside Signpost, its digital support project for people navigating displacement and disaster. The account comes from Diginomica, published August 21.
What makes this significant is what usually stays private. Humanitarian AI coverage is mostly launch announcements. This is a named organization publishing its triage thresholds, its escalation rules, and its refusal rules, starting with the design principle from Signpost director Andre Heller, that for cases requiring empathy and social skills, quote, AI has no business responding.
Here is how the system works. Every incoming request is evaluated for 2 things: whether the knowledge base is sufficient to answer it and how risky the topic is. High-risk or sensitive cases route automatically to a human with a 24-hour commitment, and guardrails flag categories like legal information for attorney review before anything goes out. The scale problem is concrete. At one point during the Afghan asylum crisis, 50,000 support requests landed on a team of 3 people.
The model is the easy part. The design question Signpost answered is which cases need a human, not how few humans it can get away with. And before deployment, the system was tested against thousands of mock queries reviewed with human experts, with Zendesk supporting the stack through its Tech for Good program.
Signpost operates in Bangladesh, Nigeria, and other crisis settings, so these are not lab rules. They are live operating commitments.
And now they are checkable. The 24-hour human escalation commitment and the risk-routing behavior are public statements about how Signpost runs, which gives practitioners in the field a reference architecture to compare their own deployments against.
Moving to the United States, the American Nurses Enterprise will receive $5 million US, split evenly between the Johnson & Johnson Foundation and Google.org at $2.5 million each, for a 3-year program called Nurse AI Training in Rural and Underserved Communities. It was announced August 20 and covered independently by Nurse.org the next day.
What makes this significant is what the money buys. Most health AI funding buys software. This buys judgment. Rural hospitals are where AI tools arrive with the least on-site technical support, and nurses are the ones deciding at the bedside whether to trust an output.
The curriculum is co-designed with nurses and covers foundational AI concepts, safe application in real clinical environments, and how to discuss AI with patients, families, and leadership. The grant sits inside a $10 million US Rural Health AI initiative the same funders launched in April, which also named Sustento and the American Nurses Foundation as grantees.
That parent initiative has 3 stated priorities: AI literacy, burnout reduction through administrative task tooling, and community-driven design with trusted local organizations. And because this is a national program run through the profession's own enterprise, its reach and completion numbers will be reportable facts over the 3-year grant period.
Pivoting to Kazakhstan. On August 18, an automated early warning system for the Talgar River Basin outside Almaty was handed to Kazakhstan, the mudflow protection service of the Ministry of Emergency Situations.
The timing matters. Glacial lake outburst floods give minutes, not hours. The basin holds 24 glacial lakes, and lakes 8, 10, and 19 sit in the highest category of mudflow hazard. All 3 now report continuously instead of by patrol.
Monitoring stations sit at those 3 lakes and along the riverbed, streaming water levels in real time to a control center in Almaty. On an outburst signal, the system alerts specialists and can trigger warning sirens in at-risk communities. It was built under a regional project by UNESCO, the United Nations Educational, Scientific, and Cultural Organization, financed by the Adaptation Fund.
For practitioners tracking early warning, the date to watch is September. The system is in testing and calibration now, and operational readiness gets assessed then in joint exercises with Talgar residents, the first end-to-end test of sensor-to-siren time that people on the ground actually experience.
Story 4, Nairobi. Citra, built by Kenyan founders Ruth Nzuki and Brian Gillow, is a phone-based web app that combines AI object detection, GPS routing, and spoken guidance through an earpiece for visually impaired users. Africanews reported it August 20.
The differentiator is the training data. Nzuki says the models have been familiarized with the African infrastructure. Uneven, crowded, unpredictable Nairobi streets, not the tidy mapped sidewalks most navigation AI assumes. Kenya's 2022 Demographic and Health Survey found about 2% of people aged 5 and older report some vision difficulty.
The numbers are specific. The subscription runs $100 US a year, free for the first 6 months, and the team is partnering with schools for the visually impaired. Julius Mbura, a lawyer with a visual impairment who uses it, says the real-time audio description tells him where obstacles are.
Kenya's National Council for Persons with Disabilities is engaged with the product, and its representative put the need plainly. The country's roads, buildings, and infrastructure are not accessible. The open question is the price. $100 US a year is steep against Kenyan incomes, so the number to watch is who keeps paying once the free 6 months end.
One more before we close out the stories. Delaware's Department of Technology and Information ran Henovate the State, a 3-day AI hackathon at the University of Delaware, where more than 40 students worked on case studies submitted by 10 state agencies: records management, customer service, transportation planning, workforce and benefits administration. State Scoop reported it August 21.
The direction of flow is the story. Agencies submitted the problems, not vendors. It is the first hackathon at the university to include state agencies and live government datasets, building on Delaware's 2025 AI Sandbox program. 4 winning projects were recognized, and the checkable outcome is whether any of them reaches development inside the state in the coming year.
On the disaster watch, GDAX, the Global Disaster Alert and Coordination System, has Tropical Cyclone Sottle at orange alert in the Northwest Pacific, with maximum winds of 241 kilometers an hour and an estimated 1.4 million people exposed near the Northern Mariana Islands in Japan. Flooding in China that began July 31 has displaced more than 309,000 people, and forest fires in Serbia hold a second orange alert. The U.S. Geological Survey recorded a magnitude 6.7 earthquake near Aniso, Peru, on August 20, and a magnitude 6.1 near Portalri, Vanuatu, both at green alert with no major damage reports.
Sottle is today's Kazakhstan story at a larger scale. The warning exists, the track and alerts are updating, and the operational question for 1.4 million exposed people is the same interval Talgar tests in September. The time between the signal and the behavior it changes on the ground.
The through line today, the field is publishing its playbooks. Triage rules on the record at the IRC, a national nursing enterprise funded to build AI judgment at the bedside, and a sensor network above Talgar heading into its first public exercise.
Every one of those published details is now a checkable commitment. A 24-hour escalation window, 3 years of reportable training reach, a September siren drill. For practitioners, that is what an operational reference point looks like. Not a claim, a date.
That's Impact Signals for Saturday, August 22, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.